Considering testosterone therapy? At BioPrime Medical, we offer testosterone replacement via multiple delivery methods, but weekly intramuscular injections remain the most flexible and clinically preferred options for many patients. These injections allow us to closely monitor dosing, adjust based on response, and avoid peaks and crashes associated with longer-acting pellets. We closely monitor estradiol, DHT, hematocrit, and PSA levels to ensure both safety and efficacy. We also evaluate thyroid function, insulin sensitivity, lipid panels, and energy levels to track your systemic response. Testosterone therapy is about more than libido or muscle mass. It affects mood, focus, glucose metabolism, sleep quality, and cardiovascular resilience. That's why our approach is grounded in data, individualized, and revisited every 12 weeks. If you're struggling with fatigue, brain fog, or diminished physical performance, testosterone optimization could be the foundation of restoring your vitality safely and sustainably.